Namaste. I am Dr. P.K. Shantakumari, Chief Physician, Matha Ayurveda Eye Hospital, Thiruvananthapuram, Kerala. Today I am going to discuss about a very serious eye disease known as macular degeneration. And the macula is the most sensitive part of the retina that lies in the retina, the innermost layer of the eyeball. So this is the place or the point where the light rays get focused. The steps of vision, that starts from the light rays reflecting from the objects. It travels in a parallel way in the air and reaches the external surface of the eyeball, and then it enters the eyeball through the cornea, a transparent outermost covering. Then it passes through the refractive media, that is cornea, then aqueous humor, then lens, and then vitreous humor, and finally get converged on a particular site, a point on the retina. This point is macula. And this is the first step for the initiation of the very complex process of vision development. From this macula, these various changes are happening, and these photochemical changes, and then electrical reactions, and then nerve changes, and final outcome is a nerve impulse. This nerve impulse is transmitted from the eyeball to the brain through optic nerve, and the final processing is happening in the brain, and the perfect visual sense is developed. From this description, it is very clear that if there is any defect in the macula, this visual impulse is not formed, and so a vision is not possible. There are different pathologies that may happen in the macula, such as inflammatory changes or atrophies or degenerations like that. So many changes may happen, but among these, the most dangerous or most serious change is degenerative changes in the macula. Such a condition is known as macular degeneration. And there are different diseases or different conditions which may develop this type of degenerative changes in the macula. For example, such as road cone dystrophy or maculopathies, and some other systemic diseases such as diabetes or hypertension that makes ophthalmic complications in the macula, that is known as maculopathies. Like that, there are so many conditions. Among these, the conditions which develops macular changes, especially degenerative conditions, this is going to be described now. And there are some typical characteristic features as developing as signs and symptoms in a macular degeneration condition. Let us take one by one. The first and very important point is blurring of vision. That will be the initial symptom that a patient may complain. There will be a blurring of vision, and it will be more prominent in bright lights or in sunlight, like that. Dim light may be a little comfortable for them. Then comes another important point, that is distortion in the vision. Some distortion in the objects will be very prominent for the patient. For example, the size of the object may be seen little different in its shape or size, or the straight line, vertical or horizontal, may be seen wavy or zigzag like, and this will make too much mental stress even to the patients. And then comes another important symptom, a scotoma. Scotoma means a dark area in front of the eye in the visual fields. That means when we look at a person, their face may not be clear, and the surrounding may be little more clear, and this also makes much difference problems to the sufferer. Then another important symptom is in the perception of distance. That means sometimes the image or the object may be seen little far than normal, or sometimes the size will be little small than its normal size. These are the advanced symptoms of the macular degeneration disease. Then also there will be much change in the color perception. The color may not be differentiated in its clear way, especially the shades of the color, dark red or dim light red, or brown and black color, and green and it's a dark green. Like the shades of the color will be, they cannot distinguish. These are the main symptoms in a macular degeneration condition. And then now let us come to the Ayurvedic perception. Anatomically, physiologically, and also functionally, this macula is the prominence. In macular area, we will get the prominence of pitta. Everybody knows vata, pitta, and kapha are the main three factors in the Ayurvedic theory. Among these three, pitta comes into the picture when macular degeneration is concerned. And pitta also, there are 5 fractions for pitta, and among these 5 fractions, one fraction that is known as alojaga pitta is confined to the eye and its functions. And this alojaga pitta also is divided into 2, like Chakshur Vaisheshika alojaga pitta and Buddhi Vaisheshika alojaga pitta. When come to its function, we can say that the alojaga pitta, which is situated inside the eyeball, is known as Chakshur Vaisheshika alojaga pitta, and that which is situated in the brain, that is known as Buddhi Vaisheshika alojaga pitta. So here we can say when there is a degenerative change in the macula, the alojaga pitta confined to eyeball, that is Chakshur Vaisheshika alojaga pitta, is to be considered seriously. And this alojaga pitta has different properties, I mean functionally. So among these, all the things are not getting vitiated always in all patients. It varies according to the causative factors or the life habits of that particular person. Among the different properties of pitta, the special properties such as ushna, tikshna, leghu, these properties are more important. That means when these properties of alojaga pitta are vitiated or aggravated, the possibility of developing macular degeneration is very high. In such a situation, along with this pitta, vata also will be associated. In some type of macular degeneration, we can say dry type of macular degeneration if this vata is associated. And the other group is there will be some other, the importance of other properties of pitta, that is visra, sara, drava. These are also the properties of pitta, and if these are aggravated or vitiated, then the symptom will be a little different. In such conditions, kapha will be associated with the pitta. In short, pitta will be the main factor, and either vata or kapha will be associated factor. Now coming to the treatment sector. Anyway, the main aim of the treatment is to bring back the properties of this pitta to the normal functioning level. Then considering this treatment sector, we have to consider this kapha and vata if it is associated with. And to achieve this goal, there are different types of treatments, treatment procedures and medications and mode of applications like that. So we have to consider 2-3 points very seriously while doing this treatment. First is the selection of drugs or medicines, because all medicine will not act in the eye. There are very specific medicines or drugs which has its site of action in the eye. These drugs are known as chakshusha dravyas. So while treating an eye disease, it is very important to select the chakshusha dravyas, and it should be very specific that chakshusha dravyas having the action on the pitta, and especially alojaga pitta should be the drug of choice. That is the main important thing. Then comes the procedure. Which procedure should be used for the medication? There are very highly scientific specialized mode of application for the treatments, especially of the eye disease. There are Aschodhana or Sega, Tarpana, Padavaga. These are the name of the treatment procedures, and each procedure is having its own characteristic impact on that particular site. So in the macular degeneration, we have to select choice of the procedure. That may, in this case, I think this Tarpanam and Aschodhana, Vidalaga are very important. So first we have to select the appropriate drug, then the appropriate mode of application. Then comes the the other factors which are important, that is body constitution of that particular person and the climate changes at that time, and the food habits of that person, and also the mental status of that particular patient. These are all to be considered. It is not a very simple thing to treat a macular degeneration. So, if we are selecting the drug of choice, again stress that the drugs which has the properties of having subsiding the aggravation of pitta and acting especially on the allergic pitta, if you are selecting such a drug and making the appropriate medicine with that and selecting the correct mode of application, if so, the result will be very success.